Medical coding errors might seem like small issues at first, but they can cause big problems for your practice. Denied claims, delayed reimbursements, compliance risks, and unhappy patients. These challenges can pile up fast. Let's talk about the most common coding mistakes and how they affect your practice. First, there's upcoding, which happens when a service is billed at a higher level than what was provided. Even if it's unintentional, it's a red flag for audits and can lead to accusations of fraud. On the flip side, there's undercoding, where services are billed at a lower level. This might seem harmless, but it means you're losing out on money your practice deserves. Another big issue is using outdated or incorrect codes. Coding standards like ICD-10 and CPT get updated regularly. If you're not keeping up, claims get denied, which creates more work for your team. Then there's mismatched documentation, where the codes don't match what's in the patient record. This almost guarantees a rejection. And finally, there's the problem of missing secondary diagnoses. Overlooking additional relevant codes might not seem like a big deal, but it leads to incomplete claims and lower reimbursements, especially for more complex cases. Now, let's be honest, these errors aren't just frustrating. They can seriously disrupt your practice. Denied claims slow down your cash flow, and correcting mistakes eats up valuable staff time. If errors happen too often, you could even attract audits, and no one wants that. On top of that, coding errors can hurt your relationship with patients. Imagine receiving a bill that's incorrect or unclear. It's confusing and frustrating. Patients might start to question the quality of your care, even if the mistake was just a simple coding error. So how do you prevent these issues? It starts with having a solid plan in place. First, make sure your coders are trained and up to date. Coding guidelines change frequently, and staying current is key. Certification programs and regular training sessions are great ways to keep your team sharp. Next, you need regular audits. Think of these as quality checks to catch small errors before they turn into bigger problems. Technology can help too. Advanced coding software can flag mistakes automatically, saving time and keeping your claims compliant. And don't underestimate the importance of good documentation. If your records don't match the codes, it's only a matter of time before claims start getting denied. Even with the best training, audits, and systems, coding can still be a tough job. That's where outsourcing comes in. When you work with a partner like Staffingly, Inc., you get access to experts who specialize in coding. These are certified professionals who know the ins and outs of compliance and accuracy. They can help you avoid errors entirely, so you don't have to worry about denied claims or compliance risks. Outsourcing isn't just about accuracy, it's also cost-effective. Practices that outsource can save up to 70% on staffing costs. Plus, it frees up your team to focus on patient care instead of fixing errors. Imagine how much smoother things would run if you didn't have to stress about coding. Claims get paid on time, errors are minimized, and your patients are happier. That's the power of outsourcing. At the end of the day, medical coding errors aren't just an inconvenience, they're barriers to running a successful practice. With the right mix of training, audits, technology, and outsourcing, you can eliminate these issues and focus on what matters most, delivering exceptional care. If you're ready to simplify your coding process and save your practice time and money, outsourcing might be the perfect solution. Staffingly is here to help. Reach out today to see how they can make a difference for you.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.